Good afternoon, everyone. Apologies for being 1 minute behind time, but in the new world of virtual meetings, we're having some technical problems. So Professor David Rees and Kofi Anie, MBE, are definitely trying to log in. So I hope that they will be with us in a short while. And at the outset, can I say welcome to everybody who is logging in for today's question and answer session. Also welcome my colleague June Okochi, who is on, who you'll see, probably the camera's on me at the moment, but you'll see June shortly. So what we thought we would do to start, to give David and Kofi time to log on, is that we will deal with some of the questions that we have had, which are less clinical really. So June and I will deal with those questions. And we had two questions. We've had questions. We've had two questions about the letter from government about not receiving the letter about shielding and having difficulty contacting the GP, who then knew nothing about it. So the position is this, for those two questions about shielding at home with sickle cell, is that everyone who lives with sickle cell, in fact people who were carriers, should have received a letter from government which told them that they were in the vulnerable group of people living with conditions that made it impactful for COVID-19. Now, what should have happened is that everybody gets the letter, but what I would say is that if there have been difficulties with GPs or getting the letter, then you should let us know, because what it demonstrates is not everybody is on the National Haemoglobinopathy Register and Database. It's probably a good point to say that people who live with sickle cell should register on their with their local centre, but that may be the reason not everybody has received it. I can assure people that we've received many calls from people who are carriers of sickle cell trait, and also people who live with sickle cell, to say that they have received the letter. So I'm just expressing my concern that if anybody hasn't got the letter, they should let us know. I'll stop there and ask June if she wants to add anything.
Hi, can you hear me?
I can hear you, June, yes.
Yeah, just reiterating what you've said, John. I think quite a few people I've spoken to had the same issues around not receiving the letter. So the best advice really is to contact your GP and let them know that you haven't received the official letter from the government, or you go on the government's website and register as someone who is shielding, because that's another option of getting through, and you can get all the support you need around maybe food parcels or medications, etc. And people also do have access to talking as well. I think some councils are offering that sort of option. So if you live alone, for example, or you're struggling with mental health issues, then you should be able to get that sort of support. So please make yourself known either through the government website or through your GP, They did miss quite a number of patients nationally, not just with sickle cell. The initial list was, I think, 1.5 million people shielding, and now it's gone up to 2.5. So that list is being reviewed and is increasingly growing. So just make yourselves known as soon as possible so you can get the right support.
Okay, let's go. We're still letting everybody know that we're still working hard to get Professor David Rees and Kofi Anie on the live link. But I'm sticking to the questions, the non-clinical questions that we had received in advance. So there's another one which we have had from somebody who says, for people who have sickle cell and are working, how long will furlough continue for those in jobs where they are unable to work from home? That's the first bit of the question. And then the second bit of the question is if employers make us redundant, what benefit would we be able to get, as I found it difficult to claim previously? So there are two questions there, and the latest position on furlough, and just so to be clear for everybody, furlough means that effectively you're not working, but the government is picking up 80% of the salary up to the end of June. So that's what furlough is. So it's the government stepping in to help employees and employers during this dreadful pandemic. And only earlier this week, the government has decided to extend the furlough scheme from June to the end of October. So the furlough scheme is going to be around for a little while. And despite the fact that the government's saying if you can get back to work, go to work, for some that's going to be impractical because of public transport and other reasons. So the answer to the first bit of the questions, furlough is here till the end of October, although the government will be trying to reduce their contribution and asking employers, and I think it will be from August time, but can't be precise, to contribute to those employees on furlough so that all the tab isn't being picked up by the government. So that's the first bit of the question. Before I go on to what if they make me redundant, I'm just going to ask June to see if she wants to add anything.
Not at this point.
Okay, I'm just being generous. That's all, June. See, make sure that I don't exclude you. So, if employers make you redundant, and one, let's be clear, we hope that that won't be the case, because with furlough, if people are able to return to work, they could return to work not necessarily on a full-time basis, but they could return to work on a part-time basis. But it's clear if individuals are made redundant, that they would have recourse to claim the relevant benefits that apply to them. And what I would say, because the individual who asked this question said that in the past I've had difficulty claiming previously, if any individuals experience difficulty in claiming, they should contact the Sickle Cell Society and we will help them through that process if they are experiencing difficulty. So I think that answers the two questions that that we've had, and I'm just go on, June.
There's another question, John. So it says, is it likely that the 3-month shielding guideline recommended at the beginning of the pandemic for people with sickle and vulnerable people could be extended?
That is possible, yes. I think it is very much possible, and at the same time, individuals, whether they're in work or not, will have to make some judgments about the threat that still remains with COVID-19. So the answer is yes, there is a possibility for that extension. This is all new, it's all evolving every day. So my advice would be that shield, because the threat is still there. Clearly the government wants to encourage cautious lifting of restrictions to enable people to go back to work. But that is only if it's safe to do so. So for those with sickle cell, and we all know this is a dreadful pandemic, it's important to shield, and you may have to make that decision yourself, even if the government gives some slightly different advice. Does that answer that question? If you're, yes. I can't see the questions, June, so
that's all right.
Thank you for being my able assistant.
Yeah, it's okay. Someone's also asked a question. This might be more appropriate for the clinicians if we can get them on the line. So it's basically, are people who are sickle cell trait carriers at risk of getting COVID? And should they basically be in the vulnerable risk group?
That's a good question, and hopefully we will get David, Professor Rees, on shortly, and he can contribute to that. But let me answer it from a general perspective, which is clear. Everybody, whether they have sickle cell, whether they don't have sickle cell, whether they don't have underlying conditions, are susceptible to COVID-19. So it follows, therefore, that if you have sickle cell trait, you are exposed to COVID-19. And the letter that went from government went to individuals who have sickle cell anemia, but the letter went to individuals who had trait or carriers as well.
Yep, I think that answers it.
Good.
I think the next question is quite similar. We've answered it. So my daughter has not received the letter from the NHS. Again, if you could contact your GP or go on the government's website with the shielding information and register there, then you should be able to get some support. It's important that we do so. Someone said, we know that some of the people living with sickle cell trait could suffer from lack of oxygen in certain situations. Is the COVID-19 among those certain situations? I think that might be a clinical question.
That's definitely a clinical question. Yeah, that's definitely a clinical question. But we do know, without prejudice to the answer from Professor Rees when he joins us, we do know that people who have sickle cell trait shouldn't be doing bungee jumping or things like that. So but let's see if David can add to that when we
I'm afraid we're still having a few technical difficulties. We're trying to get them logged on at the moment, but no success so far, but we will keep trying to get them on.
Thank you very much. So I hope everybody's heard that. We're still experiencing some technical issues for David and Kofi to join us, but it's still being worked on. So let's carry on, and we can hopefully they will join us and we can get them to add their perspective to those clinical questions that we've had, June.
Yeah. We haven't had any new questions. Oh, there's something about PPE. So people with sickle cell still need to be shielded. Should we go out wearing masks, gloves, and during the easing of the lockdown?
Well, the advice I think would be yes, because and this is consistent with the government advice. It is suggesting to individuals who are going out and, for example, using public transport, that it is advisable to wear masks. I don't think they have gone as far as gloves, but they've said it is advisable to wear masks. And we know that COVID-19 can remain on surfaces for a period of time. I don't know the exact period of time. So if somebody chose to wear gloves, which all of us walk up and down the street and see people with gloves and masks. So because of the condition, I would say that it's better to be safer and feel safe by taking those precautions when using public transport, when going to the post office or the supermarket or so forth. I would say that, and it may be slightly contrary to the government advice, but that's what I would say.
Yeah, absolutely agree, especially if people have to go into hospital for their treatments or go on public transport for whatever reason. We shouldn't be going on public transport if we're shielding. Just make that absolutely clear. If you're having a procedure or a treatment in hospital, please take a taxi or drive, walk. If you're shielding, just stay away from people as much as you can, social distance, and definitely wear a mask. I'm not sure about gloves. There's been quite a few medical advice and guidance against how you could potentially catch germs on your gloves, or just pick up bugs and stuff. So probably not best to wear gloves, but remember to wash your hands as frequently as possible. Obviously, we know that once we're out and we're back indoors, we should be washing our hands, not touch our faces. It's it's more likely to touch your face once you've got gloves on, and you just don't want to be doing that. So definitely wear a mask if you're out in public.
I think that's good advice. Just a couple of things to add to that. During the shielding that you're doing, do your best also to have a varied diet and do some gentle exercises, which is good for mind and body. So nothing extreme, but we're not going anywhere. You're shielding, so look after your diet, look after yourself, both mentally and physically, with some gentle exercise.
So there's been another question from Kemi. She thinks it's probably a question for a clinician. Is my 10-year-old likely to return to school before September? Should I wait for a vaccination before considering sending her back to school?
Thank you for the question, Kemi, and I'm sure David, because he's a very experienced paediatrician, but the first bit of advice I would say is that it's unlikely that there'll be any vaccine before September. Most experts believe that a vaccine is probably a year to 18 months away. So Kemi, don't put any store in getting a vaccine by September. So that's the first bit of advice. On the latest Department of Education information, you may or may not have seen, Kemi, that the teaching unions are currently, and this is happening today, discussing with government whether A, it is safe for children to return to school, and want to see the evidence to support that. But of course, there are safety issues for teachers as well, and how practical and safe, given the size and condition of some of our schools, that people will have to, or pupils, children will have to self-isolate. And if you're in you know, if so I'm thinking of my grandchild, if you're very small, children don't obey not hugging their friends or wanting to play with their friends. So I think we have to wait a bit more to see what the specific government advice is on that. And I'm sure more will come. There is a suggestion that certain age ranges will return from the beginning of June, but that isn't yet finalised, and clearly some schools are doing other things. The final thing I say, which is important, because you know, as a mother, Camille, you have to make a decision what's best for your child and yourself. So it's let's wait and see what additional information is available on this.
Great, thanks, John. We've got a question from an anonymous person, and then we've got a follow-up quite similar from a lady called Fumi, or a gentleman, I'm not sure. But the first one is, any advice for people with sickle cell who work in the NHS? I am a nurse myself. And then the second question is from Fumi, is, I am a nurse. I have been shielding with my son who has sickle cell. When is it appropriate to go back to work? And then she says, sorry, I've just lost the...
Take your time, take your time.
Oh yeah, that question's gone. Yeah, so when is it appropriate to go back to work, basically? And what advice do people have for those working on the front line and dealing with either a child with sickle cell or someone who has sickle cell themselves? I think, yeah.
You go first, or you want me to go first? Up to you, June, I don't mind.
Yeah, just very quickly, from my perspective, depends on, obviously, both individuals are nurses. So obviously, if you've got sickle cell, you should be shielding. And if you can do some work from home, then obviously I know it's difficult with clinicians to be working from home, but if there are specific functions you could do at home, that's probably better. I work in the NHS myself. I am not a frontline staff, but my partner is. So I think the way I would approach the situation is, if you know you're not at risk for whatever reasons and you can potentially work, then you should, if you're a carer, but you need to be shielding from your child or whoever you're caring for who might have sickle cell, if that makes sense. So the way people have done it, who I know work in the health service and may be caring for someone who is shielding, is they try to maintain some distance at home in order to keep working, but also enable that their loved ones are safe, if that makes sense. If you are a nurse or a health worker yourself and you've got sickle cell, then you should be shielding. That is the guidance from government, and you're not obliged to go into work.
Thank you, June. That's very helpful. And just to reiterate that advice about not being obliged to go into work if you are shielded in the way that June described. And that is really important for the other frontline workers, let's say, who might be carriers. But we know, and I'm just going to make this point to put it in context, the question in context. We know from the data provided by Public Health England that black people are 4 times more likely to contract coronavirus, irrespective of whether they have underlying conditions or not. The underlying conditions exacerbate the situation. So in that context, the advice that June has just described makes it even more important that you follow strict advice and safety and be cautious, because in a sense, COVID is out there and remains a threat, but actually our heritage is also an increased risk factor.
Yeah, thanks, John. We've got a question from Carol Rose. She might be a nurse or a healthcare professional.
She's a nurse. We know Carol. She's a nurse. Yeah. We know Carol very well.
Hi, Carol. Carol says, I find that my patients are very scared to attend the hospital. Therefore, they are not coming for exchange transfusions. What advice can you give for me to support the patients? That's
a very good question, Carol, and you know, so that's what I would expect from Carol, but that's a very good question. The first thing I would say is that the patients that you see in your clinic are scared, but the vast majority of the population are scared, and that, Carol, is illustrated by the fact that A&E attendances and attendances to hospital have decreased by over 50%. So that demonstrates already that there are people, whether they have sickle cell or not, who are frightened to go to hospital, go to A&E and try and manage their conditions. And that's on top of the fact that those people who may be waiting for hip operation or any other operation who are having to wait a bit longer. So the point that I'm making there, Carol, is that the anxiety and the syndrome of being scared applies to a lot of people. So what can you do? Well, this is just an example because I know it's happened in other places, but a centre that I know of has encouraged their patients to attend, specifically by taxi, and in some cases that's been arranged by the hospital to come for their transfusion. So the important message, which we clarified earlier on, is that people who need to have their regular transfusions should have access to their transfusions. And yes, I accept that some might be scared, but I think there's a responsibility on the department team to try and make that appointment as safe and as simple as possible.
Yeah. Totally agree. And from my perspective, Carol, as a patient who also has started exchange transfusions, I had one 4 weeks ago, and that was basically at the peak of this pandemic, and I was scared to death. I think it's very natural for people to feel very anxious and uncomfortable about going into hospital, given that that's a hotspot for the pandemic. However, the way I saw it is, would you rather not have your treatment, become unwell, and then end up where you've actually refused to go and stay longer in a hospital bed, potentially receiving treatment with a high risk of catching the infection? So I think it's really about weighing the risk benefits of not avoiding the care and going in, knowing that obviously a lot of the haematology units are practicing safety. I went in and there was absolutely social distancing going on in the day unit where I received my care. I think it was probably about 3 of us in the unit at one time. So I felt very comfortable. So I think it's important to for patients to go in for their care. And to be fair, when I did go into hospital, it was so quiet that I could actually hear the echo of my footsteps walking down the corridor. So I think it's not as bad as people think. I think reassuring patients that, you know, it's best you come in, receive your care, and you're well, rather than staying at home, avoiding the hospital, and then you potentially become unwell. So, and then assure them that obviously there's safety in the unit where they're receiving their bloods, and there's there's just nothing to worry about, basically. So I think that really helps. And I had my nurses assure me as well. So that might be something to practice with your patients.
Thank you, June. Thank you, Carol.
So I think we've got another question from Shanique. Will the shielding recommendation be extended for vulnerable people with sickle cell, and how long? I think we've answered that question.
We have.
And then an anonymous person says, should we wear masks if walking in a park or a field area?
And we've answered that one as well.
We've answered that as well. Okay, Fumi's come back. My work is face-to-face, as a face-to-face contact as a nurse, and a couple of my colleagues have contacted the virus at work. There's a risk of contacting it, and obviously living in a small space, she's kind of saying it's difficult limiting contacts with her son. So,
but if Fumi, I'm sure you answered this, June, but if Fumi is on the front line, whether a nurse or another specialty lead, and has sickle cell, she should be shielding.
Yeah, absolutely. Yeah. I wish the doctors were on the line. So this is from an anonymous person who says, normally I am put on a ventilator when I'm hospitalized with a chest crisis. What will happen if I'm hospitalized and need one, especially as there is supposedly a lack of them? Secondly, I've heard that being on a ventilator may potentially be increasing the likelihood of further complications of COVID patients. What happens if I go in with a crisis and contract the virus? Do I go on a ventilator or not?
That one is probably better answered by one of the clinicians. It's a very good question. The only assurance that I can give, which is factual, is that there are sufficient ventilators available within the system. So early on in the pandemic, there was a suggestion, just as there was with whether there would be sufficient PPE, whether there were sufficient ventilators. But that element is clear now, but that is a question for the clinicians. And I have to extend both June and I's apology to you all for the technical problems that have prevented David and Kofi from logging on, but I can assure you we will be running another one when they will be on, and there might also be a nurse as well. So bear with us, and I do sincerely apologise, because there's lots of really great questions there, and if we can keep those questions, we'll make sure they're responded to. But it is behind the scenes trying to be worked out, but we will have another one, and I can, you know, put hand on heart and say David or another clinician or another nurse will and Kofi will be available. So apologies for that.
Thanks, John. We haven't received any further questions. Carol has just sent her thanks to you for sharing. So
thank you, Carol.
Yeah, we haven't received any further questions. Yeah. So,
okay. All right. Well,
yeah.
That's taken us about 40 minutes, because we did start 1 minute past 3, and we've had quite a few questions. and the ones that relate to the clinical questions, the ones we had in advance and the ones that we had online, we will make sure they're addressed when we have another live Q&A session.
Yeah.
June?
Just to say thank you to everyone, and keep the questions coming. We still have roughly 23 minutes to go. If you could just ask maybe non-clinical questions within the next 5 minutes, that would be great. Until we see if we can get the doctor online. Matthew, how are we getting on?
That's a good question. So we're still struggling to get them online, I'm afraid. I'm not sure quite what's going on there. But any questions that you have had for them, we'll take a note of, and we'll be able to ask them for the next time as well. And if you have any sort of pressing questions in between Q&As, please sort of email our helpline as well, and they'll be able to help sort of more pressing issues.
Great. Okay, all right. Any more questions coming in, June?
No. Oh, hang on. Yeah, there is actually. Thank you for the live. Is there a link between the? Sorry. So someone called Tuba has said thank you for the live. Is there a link between the Kawasaki condition and sickle cell disorders? I'm asking due to the prevalence of young people among the Kawasaki cases. I'm not sure what Kawasaki means.
Nor do I. So I'm in the same boat as you, June. I don't know what that is. So I would find it difficult to even make any comment about it, because I don't know what it means. But the person who asked the question, if you could
clarify,
email us or send it in another way and explain what Kawasaki is, we'll do our best.
Okay. So an anonymous person says, hi, I am a mother with sickle cell. I have 2 kids of aged 6 and 12. Should I let them go to school?
I think we've answered that, but just to recap, and this is a recap, not a full answer. The government are discussing with the teaching unions today the question of how safe it is for children to return to school as well as teachers, and some of that is to do with the science. The thinking, and that's all it is at this stage, is that they would graduate by allowing the younger classes to return. The date for that, although government have signalled beginning of June, the date for that has not really been confirmed. And then the final thing to say is that individual parents will need to make a judgment about what they feel is safe for them and their children, depending on what is proposed by the school. So watch this space, whoever asked that question, because there'll be more information emerging about school. And the final thing I would say, and it's just general advice, is, you know, it's hard, teaching your children from home, but if there is access to the internet and school materials, then, you know, keep them occupied together with fun things as best you can until the situation is clearer.
Yeah, thanks, John. So we've got, I think some people are having difficulties logging in from what I've got, so it might be a technical issue generally today.
Yeah, may well be.
Yeah, so another question from an anonymous person. are you likely to die if you have sickle cell and get COVID? I think John's touched on this one previously. Everyone is at risk of this disease. It doesn't discriminate. I think from what we've seen across the country and across the globe, it's just best to stay safe, social distance, keep your hygiene up. Obviously, living with sickle cell means that we are obviously more susceptible to infections and viruses, and we need to be extremely careful, hence the need to shield. So just better safe than sorry. We have immunocompressed immune systems, and I think it's important that we just stay very very cautious and shield as much as possible where we can. We don't know where this is going to end. The likely exit from this virus is through a vaccine, and obviously with all of the advancements going on globally, it's going to take a long time to get to that point. So mortality is high with this pandemic. It's just best that we stay safe and cautious, even 3 times more likely than the average person who is well. So, yeah.
Thank you, June. That's a very, very good answer. There's not much that I can add to it, other than the point that I made earlier, that which June has highlighted, is that, you know, with sickle cell, you are in the vulnerable group, and you're, you know, that's why June's point about caution and extra safety is so important. And then the other point that I made is about the fact, again, this is based on data, that you know, if you're black with sickle cell, then that's a increased risk factor. So all of that goes to endorse everything that June has said.
Thanks, John. So Tuba is from Paris and says, all of my questions are clinical, but let me tell you, thank you. I am from Paris, but here we don't have sickle cell. The Sickle Cell Information Center is not active at all. So thanks a lot. So that's just a comment. Thank you, Tuba.
Thank you, Tuba. That's good. I agree with you. Thank you. And log in, Tuba, log in on the next occasion, because there will be another one, because both June and I are very conscious and very disappointed that the technical issues have conspired to not allow the clinicians to be on the call with June and I. So Tuba, please log in on the next occasion we have our live session. But if there's anything we can do to help you in the interim, just send us an email, including the clinical questions, and we will get it addressed.
Yeah, agree. Thanks, John. Which nicely leads us to our next question from an anonymous person as well. When will the next Q&A session be?
Oh, that's a good question. And given these technical issues, we hope it will be in a fortnight's time. It might. We want to make sure when we do it next time, we're not going to experience the difficulties we had today. So this was our first live Q&A, and everybody is adjusting and getting used to working from home and operating the systems. But we hope to have it within a fortnight's time. And not only that, have ironed out whatever difficulties the clinical colleagues who weren't able to join us have experienced.
Okay. I think this is from Iyamide. Hi, Iyamide. If you care for children with sickle cell who are shielded and you work within an area that puts you at risk of COVID, how would you deal with an employer who tells you to take leave rather than agreeing to furlough, even though you are entitled to it?
Well, I think I think that's a dreadful situation. So I have make no apology to say that the employer should know and do better in those circumstances. So there is an employee issue there. It's clear the government have made available the furlough scheme to support employers. They're even going to extend it till October. So the notion of saying to an employee who has children in the vulnerable group that actually take leave, I think is not appropriate. I'm quite happy to say that, and I think the individual in that circumstances should seek some support to try and resolve that with the employer, because it doesn't feel from the information that you've provided that that would be good workplace action to be taken at this difficult time for lots of workers.
Yeah, I agree. And I think from the latest plan released by the government as well, all employers are now meant to be carrying out risk assessments on all of their staff. So they should really be looking at not just staff who are shielding, but staff who are who have carers or family members that are shielding, and that should be very much taken into account, especially for the BAME ethnicity. So it'll be really great for people to push their employers and highlight the risks of being exposed to COVID and coming home to shielded children. I think it's terrible that people are being asked to take leave. So I wouldn't back down on that. I think people should just keep pushing for their rights, really.
It's John again. I'm just going to make a final comment on Yamidi's question, and Yamidi will know this anyway. The Sickle Cell Society plan to undertake a survey of the impact of COVID-19 on people who live with sickle cell and their families. And it's this sort of information that would be very valuable in pulling everything together, because at some point, and we don't know when, and now's not the time to do it, but at some point there will be some, in my view, public inquiry about the government's handling of the COVID-19 pandemic in this country. We know there have been issues with PPE, we know there have been issues in care homes, so there will be some form of inquiry, and the purpose of that survey that we'll do is to gather as much real life evidence of the impact this has had on individuals who live with sickle cell. So I'm just giving a little notice of us doing that work and wanting to get back the valuable insights from people, which we hope will go towards ensuring both policy is improved, and if there was a further pandemic, that the lessons from that were clearly learned. Yeah.
Thanks, John. We've got another question from Joy. Please confirm that it is okay for me to go for a walk now that the lockdown has been eased. This is a tricky one.
It is a tricky one. It is a tricky one because, Joy, thank you for the question. It is a tricky one. So it's not a clinical question, and June and I will do our best to advise you. But earlier on, there was a question which I responded by, and June responded, in fact, but I added after June's response that because of shielding, please ensure that you vary your diet and have a good diet as well, and to do some gentle exercises. And I was talking about those gentle exercises at home rather than out. But if you do choose to go out, there was another question earlier where we were clear, both June and I, if you do choose to go out, and bearing in mind the advice is shield. If you do choose to go out, then I would advise strongly that you have a mask and you get back home quickly.
Yeah, I agree as well, John. I think the advice is to shield, and if you're in the shielding category, you absolutely shouldn't be going out. However, I know a lot of people are using common sense and using their discretion to practice social distancing and walk in very quiet places or quiet environments around their homes to get a bit of fresh air, or just spend time in their garden. So the advice is to shield, but if you must take a walk, please do so on a very quiet street, on quiet roads, in a quiet park, and try to avoid people as much as you can. And obviously don't spend a lot of time having any contact with people in a very tight space. So that's what I would say, but shield as much as possible until we hear from the government what the next steps are. We've got another question from this anonymous person. What additional medication can be taken to boost immunity in young people and people with sickle cell? Are there any of the general recommended ones that are not suitable?
Well, I guess let's leave that one to the clinicians. That's a good question, because there's the usual information about folic acid and for young children, and my other point about vary your diet, have a good diet, not smoking, and gentle exercise. All those things are positive. But let's park that question. So it's a good question, particularly at this time, and particularly if people are shielding. It's a very good question. We will answer that question with our clinical colleagues. Yeah,
I agree. So another question from an anonymous person: what types of support are being provided to people with sickle cell from the society in response to the coronavirus?
That's a very good question, and it revolves around a number of things. So the advice that we have put out, the written advice that we have put out on our website, has been commended by government and others, because at the very outset of the pandemic there was not very much information, because COVID-19 was so new, of what this meant for sickle cell. So the ways in which we are seeking to support our sickle cell community is by advice, information, and despite the fact that our office is closed, we have been continuing to work and field be it telephone calls, be it emails, be it social media contact on the issue of COVID-19. And I can tell you that for the first 2 weeks of April, the volume of emails and calls, which all have been responded to, was probably about 60% more than we would normally receive. So it is very much about giving information, advice, signposting where we need to signpost, but equally working with the NHS. So there've been nurses on who've asked questions today, but working with the NHS to ensure, for example, that regular transfusions can still continue safely. Today's first, I know it's the first, and it's been problematic because David and Kofi were not able to log on, but having live sessions, questions and answers. And then there'll be work that people like Yamadi and other members of staff, Tracy, Alinta, who will continue to do, except the difference is that they're going to continue to do that work, but looking at virtual ways to do that work because of the social distancing requirements. So the work that we planned around engagement in Hackney, the work that we're doing with blood donation, the work we're doing with the screening programme is going to continue, and that's directed to support people. But the difference is that we're having to be imaginative, creative, and think about how we do that in a virtual world. So so that's what we're doing. The final thing I should say is we're continuing to do that. So we haven't furloughed anybody. Everybody, we've got a small staff, everybody is continuing to work and doing that from their homes. But the impact of COVID-19, so think about it for a moment, the impact of COVID-19 on the UK economy, the global economy, has been significant. If you then drill down and think about that impact on the charity sector, so the charity sector, Sickle Cell Society, is not funded by government, it's funded by work we do for fundraising, donations. That's taken a significant hit, but nevertheless, we're trying to get ourselves back on an even keel despite the significant economic impact of COVID on the organisation.
Thanks, John. I think we've got 3 minutes, but there are quite a few questions, so we might need to pick them up at the next session, but really interesting ones as well.
Okay.
So we might, should we take one more question?
Well, we can. We started at 1 minute past 3,
Right, okay.
so I
So
think we could
questions?
probably take a few more questions if you're
Okay.
happy. And
Yeah,
again,
sure.
I say to the audience out there, I really apologise, because it would have been so good if, for the clinical ones, that David and Kofi were here. But if we give it another. Are you okay with another 5 minutes? I think the only thing we can offer, given that the clinicians are not here, is that we can extend it for 5-10 minutes max to deal with those additional questions, and particularly if they are interesting and important ones.
Yeah, sure. So this is from an anonymous person as well. I was supposed to travel to Africa in March for a family funeral, but my flights were cancelled. If airlines allow travelling again, is it advised that I do not travel? I have sickle cell, and obviously the healthcare system is very different in Africa.
That's a really good question, and we don't know at this point what the situation for international travel will be, because I'm just using an example now. In the UK, in recent weeks, the government have decided anybody who's coming to the UK apart from France has to be quarantined for 14 days. Whether if you travel to Africa, that will be something that they might put in, one doesn't know. So it's a really good question, and I think that there is more advice and information to come on the question of international travel, particularly because social distancing will be here with us for some time yet. And are you going to social distance on a plane with queuing up for the toilet and who's sitting next to you and so forth? So it's a really good question. We have generally given advice, not COVID related, about travel to when people are going to Africa and other parts of the world with their sickle cell. That advice still applies, but in this situation it is and it's a good question. It's one I think that we may follow up with some more work on that. Really great question, thank you. All the questions have been good, but this is one where actually we haven't put that much thought, or government hasn't put that thought, because the airline industry are still working through what their next step is because of the financial hit it has made on them.
Yeah, I agree. And what I would add to that, John, is I think it's a waiting game, really. Still lots of travel restrictions globally, and quite a few borders are still shut to tourists coming in. And I think just given, I mean, repeating what John has said, social distancing is here to stay. The virus is still here to stay, obviously, until we start to get vaccines in place. So I think it's probably not the safest thing to do to travel anytime soon, especially if you've got sickle cell. However, if it's absolutely essential, and it sounds like there's a family funeral, just ensure that you've got your travel insurance and you let your haematology team know that you're going away. And if possible, you know, try and maybe let your airline know that you're shielded, and therefore they can make some arrangements for you. But probably safe to not travel at this time, except it's absolutely crucial.
I agree with you, June. I would, you know, so if that person who asked the question was my daughter or my sister, and I had to travel with them, then I'll be saying, I think in the circumstances we have to find some way of supporting our relatives back in Africa or wherever it might be, but it may not be by traveling at this particular point.
Yeah, absolutely. Another question from anonymous person. Any idea on how to keep morale up whilst having to stay in? I have sickle cell. I'm fairly young. I'm losing the will. I'm working from home. I try to do new activities. I'm exercising, trying my best to eat healthy, but I'm still really down, but don't want to get too depressed. Any ideas for how to keep morale up?
That's a really good one. Well, we're trying to keep morale up, and it's, you know, hard because of shielding, but the good thing is you're eating well, you're doing gentle exercises, and why I'm mentioning those to the person who asked that question is all of that is good for one's mental health and body at the same time, and yes, it's hard, and this is where I think that family and friends and colleagues through media such as this, you know, get in touch, speak to people, talk to your friends that you would otherwise have, you know, met if you're at work or socializing, and keep those contacts going so that you don't feel alone, for the want of a better word. So I think that person who asked that question is doing the right things, but experiencing that I still need to motivate myself and keep positive, and I would very much encourage that. And back to the question we had about support, there are things on our website that you could join in. There are little challenges that you can do from home, little different things that you can do virtually that we have suggested. So keep doing what you're doing. Yes, that I know you're asking, is there more that I can do to increase my motivation, morale? But keep doing what you're doing, and what I'm saying is talk to your friends, family, and keep those contacts going. Yeah,
absolutely agree. It's a very difficult time for all of us. We are human beings who obviously have social connections, and when that is cut off, it's extremely hard to deal with life. So as someone living with sickle, I really have some bad days where I'm really anxious and again bored because I work from home and I do the same things you do. But it's a very different life, and we just need to keep those human connections going. And like John has said, stay in touch with friends, stay in touch with family. I'm in touch with my family every single day. even more than ever. And it's very funny to see how my dad uses FaceTime, because I only see his forehead, not his face. But it's just find the small things that can just make you laugh, watch a comedy, yeah, listen to music, write if you have to. Yeah, and it just sounds like you're doing the right things, basically. So quick question from an anonymous person again: would you be able to extend the invite to all sickle cell patients across the country? That's for you, Matthew.
Yes, yes, we will be. So this one was a little bit of last minute in terms of sending it out, but for the next one we'll be sending it out a little bit earlier, and we'll be putting it on our social media, so anyone in the country, actually further afield, anyone who's got an internet connection can come and join us next time. We'll also be sending it around to our members via email as well. So if you're not a member already, it's completely free to do. Head to our website and become a member, and we'll send out invitations and links to this and all the other events that John was mentioning that other members of staff will be running at other points. That should all be advertised through our membership. So yeah, anyone is welcome to join.
Absolutely, and thank you, Matthew. And I did mention earlier that we're going to have another one in 2 weeks' time. So if you've got friends and family up in up north or down in the south coast or wherever in the country, let them know we will be doing another one. And we've been very heartened with all, and they're great questions. They're great questions.
Yeah.
And it's live, so it's, you know, apart from the questions that were submitted in advance, which we dealt with at the beginning, it's live. So we're giving our honest, lived experience to you all.
Yeah.
We will also.
Shall we take?
I would say we will also, I believe, if we haven't had any more technical issues, this should have been recorded as well. So if anyone has missed it, or you want to go back and see what we said about one of the answers, then we will be uploading it to our YouTube channel, so you can go back and see what we said about various different topics, or for anyone who's missed it.
Thank you, Matthew.
Okay. So we've had, I think, a question or comment from Dr. Assar. I hope I'm pronouncing the name well. Yeah, so actually, we've got a response and a question. So regarding the question about travel to Africa post-lockdown, while commending the answer given, may I suggest that you also consider signposting to the travel clinic at your GP or any other surgery near you. Of course, you can also approach the travel clinic at the London School of Hygiene and Tropical Medicine. They do have good service on this for free. Just Google the name for contact details. Regards. Thank you.
Thank you. Thank you.
That's really helpful. And then Dr. Asa again says, more of a quick word to commend you folks for this very timely and helpful initiative. As ever, anything I can do to rope me in, well done, and keep it going. Greetings from all from Kingston upon Thames.
Thank you, Assar. Thank you. That's very kind of you. We know Assar very well, so it's good to hear his voice. Glad that he has logged in, and I'm sure he'll log in again. And thank you for your feedback. That's helpful.
Yeah, and then quite a few thanks. Thank you, everyone. And then Betty says, will there be a replay link sent out later? I think Matthew answered that question a minute ago. So there'll be a YouTube link recording this live so people can watch it if they didn't have an opportunity to engage with the live show. And I think that's predominantly all our questions. If I missed your question, we promise we'll pick it up at the next one.
Thank you, June. And can I say a big thank you to everybody who asked questions. I've thoroughly enjoyed it because it's important. It's important for our community, and we have to work together to keep people informed and safe in these difficult times. And it's now 10 minutes past 4. We said we would go on for 10 minutes max. We've done so. and as I say, once again, apologies, but we hope to resolve, and that's my mobile going off for my so on that basis, bye bye everyone. We'll conclude and see you in 2 weeks' time.